Hello and welcome to Acadicus. Today we're going to be going over the Pediatric Airway Readiness Simulator. In this virtual reality immersive simulation, we'll go over some key components that'll help get you ready for one of the most stressful pediatric procedures there is, airway intubation in a patient with impending respiratory failure. We'll go over all the equipment needed to instrument the airway, as well as some techniques for how the room should be set up to maximize your success.
We could put it right on the wall underneath your ophthalmoscope. So now we need our standardized patient and use the gauze to capture the contents of the incise and drain.
In today's simulation scenario, we'll go over the proper setup for central venous catheter insertion. The catheter that we show here is a triple lumen central venous catheter. Now, as you can see, the wires as they come out of the kit have a J-tip, and they have this guide, this blue dark guide on it. You slide the guide forward and you straighten out the J-tip.
If we were to do this in real time, we would need several engine crews, several pieces of apparatus and ambulances. You can imagine it would be quite time-consuming and costly in terms of resource management. I now see one victim face down. Think back to your incident command 101. What is your primary goal?
So as I'm feeding that wire, I want to make sure someone's looking at the monitor and see if there's any PVCs or ectopy. Dilate that skin track all the way down to the blood vessel, and it'll make it much easier for that central venous catheter to go.
One of the things we think about is not blocking our ambulances in so that they cannot accept patients and leave the scene rapidly. I can actually go inside the ambulance.
And remember, we're measuring from the corner of the mouth to the angle of the jaw. This one in my left hand would be way too big for this patient. This one in my right hand is perfect size.
You could customize a pump panel to have the pump panel look exactly as the pump panel did for your fire truck or your apparatus to do orientation training.
Interact with all the different pieces of equipment that I've shown you here. Try them all out, practice with them. And then in the third level of Acadicus, changing the environment, adding different pieces of equipment that you don't see here, things that you may use in your hospital, changing the scenario. I don't want it to be in the pediatric ICU. Maybe I'd like it to be in the emergency room because that's where I work. So Acadicus gives you all those options.